paper to take notes if there are questions. Okay, this will work. All right. Got this. All right, looks like we are operational. Hi, everybody who's out there. We'll give it just a few minutes since it's not quite 8:30 yet. That was quicker than I thought it would be.
Good work.
Yes, yeah, that worked out very well. Are you guys reading anything great right now, or watching any fun shows or anything like that?
So, reading a bunch of books, but the best show, if you haven't seen Ted Lasso.
Oh yeah.
Oh yes, we started that.
Yeah,
It is such a fun show.
It's such a nice show. I use the word sweet, but it's just gentle, kind, and funny. And
it's exactly what we need.
Have you watched the two this year yet? The two new ones yet?
Yeah. We watched there are a couple of them that have been put out. So I think maybe two of them or three of them. I don't remember.
I like that.
And then we're watching that one too, which is
which one?
Megadoon.
Oh yeah.
I don't know what that is.
Oh yeah, it's kind of a spoof on the
Brigadoon.
Yeah.
Oh.
It's like a combination of Carousel, Brigadoon.
Yeah.
Nice. That's so fun.
Two physicians and plopping them in the middle of a musical, basically.
That sounds about right.
Yeah.
We can do that for our COVID task force.
Yeah. There's another one called Startup.
Yes.
Have you seen that one? Have you guys watched Startup a little bit? Or?
Yeah, yes, we have like some connections with through Lauren's family with that, and it is just it's another really fun show.
No, but it's very entertaining.
Yeah, for sure, extremely entertaining. And Meredith says that she's about watching the Olympics. That is great. Yeah. Well, I see it's just about 8:30. I'm gonna I gotta run and grab a different pen, but I'll do that in a moment after we get you guys started here. Oh, and Roger's leaving. That's enough. He's had enough already.
Oh, he's bailing.
He's bailing. Yeah, he's back. All right. Well, let's see here. Yeah, we'll give it just a few more moments, and then we're gonna get started right at 8:30 because we don't want to keep you guys here all night. Oh man, all right. Are you both coming to us from home?
Yeah.
You got it.
That's fair enough. All right, good. At least you don't have to travel anywhere.
Docs in black. You got your black attack.
Docs in black. Yeah. I wish you could do that.
Come on, I'm wearing blue.
Oh, fair enough. Fair enough. Well, I think we'll get started. It's 8:30. Looks like we've got about 20 people watching us on Facebook, and we've got a bunch of people on YouTube and a bunch of people on our website. So we got people in all three places. Let me just tell everyone before we start, the only place that we're going to be taking questions from is on Facebook. So hop on to the Temple Facebook if you're watching one of those other two places if you have questions, just because it's hard for me to monitor three places. So we'll do that. And I wanted to welcome first the co-chair of our COVID task force at Temple Beth Shalom. It's Roger Friedman, and a member extraordinaire of our COVID task force. That's Dr. Jen Silver. And I'm wondering if you guys could each maybe just give us a quick bio about yourselves. We know you in the Temple capacity, but you have a whole professional capacity from which you speak tonight.
Go on, Jen, you go first.
Okay. Yes. Hello, everybody. I'm Jennifer Silver, and I am a primary care physician. I work for Ohio Health in Gahanna, and on the ground with this. So we've been dealing with this directly for the past 18 months and managing patients in the outpatient world with COVID and post-hospitalization with COVID. So I'm happy to be here tonight, and thank you guys for having me.
Well, thank you. We are so glad to have you. And Dr. Friedman, you want to give us a little?
So I'm, of course, Roger Friedman, and I'm a pediatric allergist immunologist in the twilight of my career, which previously had involve mainly taking care of children and adults with allergies and asthma and food allergies and all that sort of stuff. And like so many of us have been drawn into the COVID warp over the last 18 months, as I'm on 7 different coronavirus task forces. This immunology moniker got me in big trouble. Again, I'm from Cleveland, Ohio originally, Miami University, Ohio State. I'm at Ohio ENT and Allergy, where I'm one of our senior people. Actually, I'm the oldest person, and also on staff and do lots of stuff at Children's Hospital through the last 40 years. And I'm the past president of Children's Hospital and the past president of Ohio State College of Medicine alumni. So do a lot of interesting things. And unfortunately, COVID has taken over a good part of, like many of our physicians' lives over the last 18 months.
Well, and we so appreciate you two and the other docs and folks on our task force sharing your expertise with us and helping us to figure out how to be safe at Temple programs. We had felt like we were in such a good place, and if I could bottle up June and live in June for a while, I think that would be really lovely. But we're in this reality now, and we're grateful for you guys to be able to talk us through a little bit of what's going on. Let me tell the folks out there who are watching. I know we got a bunch of people in these different venues. If you have a question, if it's a burning question, see your doctor. But if it's something else, that you can put it right in the comments on Facebook. But I saw the outline that Roger and Jen are going to be using, and they are covering a lot of ground. So you may want to wait with your question until the end. But if you do have a question that relates to something that they're saying, you could certainly put that in the comments on Facebook, and I will jump back in the conversation and throw your questions out there to these guys.
And we promise all questions will get answered. Okay.
All right. That is big. All questions will get answered. All right. Well, that being said, I'm going to let the two of you kind of take off here. I know you have this very good looking outline. I'm going to make myself scarce here, but I'll be watching the comments. Thank you again.
Okay. I guess I get to start, right, Jen? So yeah. The first question that we want to talk a little bit about, and that is, what is this Delta variant and where the heck did it come from? I think as many people know, this variant of coronavirus is SARS-CoV-2, COVID-19. It came from India. That's where it was originally diagnosed. And it rapidly spread through India with causing terrible death and destruction in its wake. And as anticipated, there's no surprise that it was going to come over here. We knew that it was going to come over here. I don't think we knew how quickly it was going to take over and become the prominent variety of COVID-19, of the coronavirus. But now it's, I think today's data is that 93% of cases are due to the Delta variant. It's important to know that all viruses mutate. That's what they do. They are, the best way about thinking about a virus is think about a shark. Their goal is to eat and survive. Their goal is to live, propagate, and jump from host to host, preferably not killing the host, because if they kill the host, then it's harder for them to jump to someone else. So again, their ultimate goal for the perfect virus, like the perfect shark, is to be highly infectious and not too lethal. And sadly for all of us, SARS-CoV-2, the COVID-19 as we call it, has been a really good virus. And the original varietal, the alpha variety, was very infectious, killed a small percentage of people. But when you infect, 1 billion people, again, if you kill if you kill 1% of 1 billion, that's 10 million people. So that's a big number. And so that's how it's happened. And that's, we've had other varieties and we got more coming. Don't worry. If you're bored or upset with Delta, just wait till Lambda. And unfortunately, the Greek alphabet has even more letters in it. And so we're going to keep seeing more varietals, and that's what we can expect. The second one for me that this kind of morphs into is what makes this different than COVID-1? Well, there's a bunch of things that make it different, sadly. Number one, it's way more infectious. You learned maybe early in the coronavirus outbreak, we started to talk about a number called the R naught. And basically that's a epidemiology number and one that most of us in medicine don't use too often. But what it meant was how many people one person infected would kind of infect. And on average, the COVID-19 was pretty darn infectious. And about 3 people were infected for every person who got COVID. Again, that was bad, and it's why we had such a pandemic and outbreak. The Delta variety infects somewhere between 5 and 8 people. So it's 2 to 3 times as infectious, and that's why it's spreading like wildfire. 2 other kind of 3 differences actually, but one more important one is that this virus tends to produce a greater, I'm going to use the word viremia, more viral particles when it infects you, and maybe even as many as 1,000 times as many viral particles as does SARS-CoV-2 that we're used to. So again, not only is it more infectious and more contagious, you produce more virus, and that's one of the reasons it's so much more infectious. When some of the early data with the original COVID infection showed that if you were in a family group, like husband, wife, that somewhere about 50 to 55% of the spouses got infected. So it was more than half, but that was about it. Now we've talked about the Delta varietal as being as infectious as chickenpox, and chickenpox is about our most infectious agent. And so if you have a family unit now of 5, a mother, a father, and 3 kids, and one of them gets Delta, the chances are they're all going to get infected. Not just one of them or 2 of them, but at least 4 and probably 5. Again, that has to do with, again, the fact that it has more virus, more infectivity. The other 2 nasty things about this, and then I'm going to go to Jen, but the other 2 nasty things, number one is that this virus, this varietal, our vaccines are about 83% effective. Now that's still darn good, but against the alpha variety, they were about 95% effective. So again, a significant decrease, meaning you're all going to hear about, if you haven't already, friends, neighbors, family, people in the news who got vaccinated, yet got COVID-19. And that is just a reality, and that's going to happen. We'll talk more later on about severity and all that sort of stuff. And the last bit of bad news, and all I've spent my life the last month about talking this is I feel like Darth Vader. All I do is come and give gloom and doom. But the last bit of bad news is that the original COVID-19, SARS-CoV-2, original, it was almost impossible to spread this disease outside. It was almost impossible if you were outdoors. It took us a long time to realize it. And it's one of the reasons why Florida and Texas survived using less than perfect health, public health measures early in the pandemic, because it turned out they ended up being right in a way that it wasn't very contagious if you could be outdoors. And unfortunately, the Delta variety is contagious outdoors. So we have to be more worried now, and we're going to talk more about that as we go along. And I'll stop now and let Jen add some of her expertise. Thanks.
So yeah, and actually there is one question that I'll let Benji and Roger know that there's actually one question that we are going to discuss that I don't see on our outline that I'm going to add in here that's very relevant for today's news broadcast. If anybody saw that at 11 o'clock today, the Columbus Public Health came out and talked to the citizens of Columbus about why the urgency, why get vaccinated, why now, what do we need to be thinking about? And when we talk about Texas and Florida and the surges that they're seeing there, we have our own little surge going on. We're actually predicting that most places in the United States are going to end up seeing some version of a surge, and how bad that surge is going to look is going to depend, largely on vaccination status and people following protocol. But we have a surge going on here in Columbus. And they spoke to that today, just to debrief, some of the things that they talked about today, that the hospitalizations are quadrupling in Columbus. And this has just been in the past few weeks. If we go back and look a month previously, we wouldn't be having this conversation. We were seeing low levels of COVID, and now we are up to, we're breaking the 2,000 cases. That's for the state of Ohio, but Franklin County is a hotspot, and we have been upgraded from a moderate transmission to a substantial transmission. So if you look on the CDC website and you look at where we're having the worst problems in the country, Ohio actually doesn't look too bad. We're mostly in the moderate on the little CDC map. So that can be a little bit misleading. But if we target in on what's going on here in Columbus, we actually have a substantial amount. And keep in mind, the CDC data lags by a week. And that week is very significant. So our hospitals are feeling this, our positivity rate. And what that means is the number of people we send through our testing site, what percent of those people actually have a positive test for COVID? And we use that as a marker for what is considered a significant spread. And earlier in the pandemic, we were watching which states would hit a 15% positivity rate, which indicated a very high level of spread. We had fallen down, and even a month ago, our positivity rate was 2% here in Franklin County. It is now jumping up. It's now jumping up to 5% plus. And actually with I can speak for the Ohio Health numbers, actually seeing up to 10% of our through being positive for COVID. So we are definitely seeing a surge. The numbers are going to lag as we're collecting our data, but the hospitalizations tell the truth of what's going on. And our hospitals are suffering for that. And the group of people that are coming in are a younger group of people. So in the early part of the pandemic, we were seeing more of the 70s, 80s, 80-year-olds. Now we're seeing 40s, 50s, and 60s as a predominant group, and a lot of people who felt that it would never happen to them because they were too young and healthy. We're even getting 20-year-olds coming through. So the Delta variant has changed the scenario. And one of the things I wanted to touch on too is symptoms of Delta. Very similar, similar to what we've been dealing with the original COVID virus. The difference we're seeing with Delta, we're seeing a little bit more from the upper respiratory tract. It tends to give a sore throat, a runny nose, symptoms that people will blame allergies for. Thank you, Dr. Freeman. Or they'll tend to dismiss because they're so mild in the beginning, particularly for those who are vaccinated. It tends to be a much more mild situation, although they're still as contagious. So we're seeing a lot of more upper respiratory. We are still seeing all the lower respiratory and all the other symptoms of COVID, such as the cough, the fever, the muscle aches. We're definitely seeing those, but definitely a very prominent upper respiratory symptoms. And then the loss of smell, which has been something that we have targeted from the beginning of the pandemic. It tends to be a very common symptom with the Delta variant. So you got to look for all the originals, but definitely be mindful of the what people might blame on seasonal allergies, particularly as we're in ragweed season. If this is not your usual allergies, if this is your usual deal, you feel like, okay, this is the stuffy nose I've always dealt with. You have to really analyze your symptoms and go, is this something different, or is this my usual July, August crud that I have? And then as far as quarantine contagious period, the Delta variant, another difference in it is people are getting sicker faster. Yeah, the previous COVID the original COVID, it was 5 to 6 days before we would have an exposure to a positive test on average. And the Delta variant is 3 to 4 days. So we are seeing that flip over quickly. If someone's been exposed, you can reasonably get a positive test within 4 days at this point. The quarantine period is still a 14-day. If you've been exposed, if you're vaccinated and have been exposed, we aren't saying that somebody needs to quarantine if they're vaccinated, but they need to watch for symptoms. If you can quarantine, if you've been exposed, that's always best, because that's best for public health, to work from home, to avoid public places. But the CDC is not stating that you need to quarantine if you're vaccinated. If you're unvaccinated, you really should quarantine for 14 days. And then once you have a positive test, it's 10 days that you do need to isolate at that point, and stay away from others if you have a positive test. And then after 10 days, you're considered able to move around the community.
I wanted to add just one thing to Jen, and then we'll take a break. If we have some questions, we can start going in. But one thing is that the CDC changed, and you know this, but that if you are vaccinated and exposed, they definitely suggest being tested now. Whereas at first, in June, as Rabbi Barlev, hope we go back to June. In June, if you've been vaccinated and you're exposed, you didn't have to be tested. Now they're recommending testing. And that can help with the quarantine part too. That if you're negative and test once or twice negative, that you may get out of jail quicker for some people.
Yep, and that testing would be on day 4, would be considered viable, as opposed to waiting 6 days. Right.
There you go. Thanks.
Just a quick question to throw in, because you guys are talking about the quarantine if you're vaccinated. Somebody had asked earlier, you'd mentioned that that the vaccines were about 85%. Someone had asked about Johnson & Johnson. Is that the same number or is it lower?
Johnson & Johnson is a little lower. They haven't given us yet data related to Delta. So their numbers were closer to 70% to begin with. So our presumption is that they're going to be lower for Delta.
Got it. So one other question that just came in, Rachel asks, what do you think will happen once schools go back in session without masks? We know
let's keep that one because we're going to talk about
right.
that.
Yeah. We'll get to that one. We'll get to that one later. All right. I'm going to leave again and let you guys keep going.
Okay. So Jen divided up this thing, and so she gave me the mask one, which I would have given her that one too. But she knows that that I like controversy. So the question is, let's talk masks. Who should be wearing them? When? Why? How? And I'm going to give you our best science knowledge of now. And again, first of all, masks work. If anyone's out there listening to us and say, well, I've heard they don't work, or I've heard they do this, masks have been a tried and true public health measure for a long, long time. And we showed very good data in the first year of this pandemic that wearing masks can protect you. Both of us worked in healthcare and were exposed to lots of people with COVID, and we were wearing PPEs and masks, and we didn't get sick. And that isn't the whole answer, but the answer is if everyone's wearing masks again, we can win this thing again, because again, all pandemics end. And the pandemic, the Spanish flu of 1918 went on for 2 years, and the second year was worse than the first. And so luckily we've had a vaccine that's very effective, and luckily we adapted reluctantly mask mandates and social distancing and all the things that we did. So masks work. The CDC a couple of months ago lifted their mask mandate, and they did so because at that point it made sense that and again, it's important to remember what they said. If you'd been vaccinated, you did not need to wear a mask indoors. If you hadn't been vaccinated, you still needed to wear a mask indoors. They never changed that. What changed was that most everyone stopped wearing masks, whether vaccinated or not. And if you went to Giant Eagle or went to a grocery store, last month or even 2 weeks ago, in general, the only people wearing masks were vaccinated people who were scared of getting COVID. The unvaccinated people, for the most part, didn't want to get vaccinated and they didn't want to wear masks. So what do we need to do? In my opinion, and the CDC's and Dr. Fauci and all the others, what we need to do is we need to go back to wearing masks indoors for everyone. Because again, the Delta variant of COVID can spread indoors tremendously, and a significant number of people who are vaccinated are getting it. So you want to protect yourself, you want to protect your family, and you want to protect others. And it's a simple thing to do. When you're indoors, wear a mask. That's really the sum of that for masks for right now. As far as indoors, it's absolutely essential that we all go back to wearing masks. Many people are suggesting, and I would encourage all of us, especially people on this call who want to stay healthy and safe, it's time to pick up the level of your mask. We have better masks now and they're available. I'm going to show you my KN95 that I wear at work and wear in the stores and stuff like that. They're not very expensive now and they're available. You can get them for, $2 on Amazon or $1 in other places. And again, you get 3 of them and rotate them and use them, and they will work and keep you healthy. And I think anyone who is working indoors around other people, and that would mean if you're working in a restaurant, if you're working in a deli, if you're working at Block's Bagels, and in particular, if you're a teacher, especially of kids under 12 who can't be vaccinated, and we'll talk later about opinions about should they wear masks, which obviously, my opinion is yes, and the American Academy of Pediatrics is yes, and every main medical society is yes, but school boards may decide different things. But if you're a teacher, please, and this goes for our Sunday school teachers, wear a mask that's going to not only protect others, but protect you. Now, one of the main differences with masking right now is outdoors. Again, before COVID variant, before the Delta variant, outdoors was highly unlikely to spread the virus. It really was safe. And it's still, by the way, way safer than indoors. So I want to make sure I emphasize that. It's not like outdoors is deadly. It's just that indoors is just much more likely to cause a problem. Outdoors is way less likely. But if you're in a crowd, and when people look back, they're going to realize once again, and no one's talked quite enough about it, this surge started with our July 4th holiday. That's what triggered this surge. Just like most every other parts of the surge have been based around holidays where people get together. And this was the first holiday in a year and a half where everyone said, okay, we're normal. If I've been vaccinated, I'm okay. And even if I haven't been vaccinated, if I'm outside, the doctors say I'm pretty safe. And we thought that was going to be true. And it turned out it wasn't. And that's because of the Delta variant. And we have this surge and peaks and things. Everyone knows of people who went to a July 4th fireworks, who went to a barbecue and a cookout with 5 families, who went to a wedding after July 4th in Columbus, 150 people, 30 of them got COVID, and it was an outdoor wedding. So that's why, if you're going to be in a group, if you're going to go to the Clipper game, if you're going to the Crew game, if you're going to go to, again, an Indians game, outdoor stuff with lots of people, especially random people who have a mixture of vaccinated and unvaccinated, wear your mask. And be very careful, again, about eating, both indoors and outdoors, because, again, you have to take off your mask to eat. So obviously, if you go on an airplane, you're going to wear a mask because that's a federal law. Fortunately, they didn't change that. But again, you want to just go back to a couple months and say, okay, I just need to dial it back. This surge of Delta is going to end. Now, we hope that Lambda won't be worse or Delta 2 won't be worse, but it will. And we just want to get through it healthy and not get infected. I think that's very important. Let me answer the next question, and then Rabbi may have some questions that we may or may not answer. The other question is, what about things like gyms? What about working out in a gym? If you listen to Roger Allen Friedman, I would tell you that now is a great time to not work out in the gym. Now is a great time to work outside. Now is a great time to walk, run, bike, lift weights, do anything you want outdoors. if you're going to go to a gym, and lots of people still want to do it, please wear your mask and wear a good mask and wear it all the time when you're working out. I know how hard that is. That may encourage you to work more, outside than inside. If you're going to go to a restaurant, great idea, but try to go eat outdoors. Try to eat on a patio. And again, I'm still a tiny bit worried because, again, it depends how crowded the patios are and stuff like that. I mean, the joke is, right, you go into a restaurant, you wear your mask until you're seated and you take off your mask. And apparently COVID knows that you're eating, so it's not going to bother you. But I don't think that's it. And we've got lots of data that restaurant eating has been disadvantageous to people and significant amount of people getting infected at indoor events when you're not masked. I mean, so do I think you can go to a movie? My answer to you is yes. I think you can go to a movie theater. You wear your mask the whole time, and I think you're pretty darn safe. I think that's, you got people you want to separate somewhat, but I think some of those things are reasonable to go. We're going to have coming up, in a few months, not too long, Columbus Blue Jacket games, Ohio State basketball games. Is it going to be safe? I think, again, it depends on community spread, but I also think that wearing a mask makes things safe. And so you just want to, again, not be me and eat everything that ushers that they come by and sell me at games. When I go to lots of baseball games and people ask, when do I leave? And I said, usually it's when I'm full. So I'm going to have to eat before I go. I'm going to stop now. Any questions, Rabbi, before Jen gets on?
Well, the question is about what do you eat at these games, but we'll get to that later. So a couple that are, I think, related to what you guys are talking about. Jamie is asking about, and Jen, you might cover this next. She's asking about she's got a wedding scheduled for 100 plus people who are all vaccinated at the end of August for outdoors. What do you think about that? So I'll let you think about that for a moment. Meredith wants to know, is religious school happening this coming year? We are planning to have it. Everyone's going to be masked, and if something changes, we'll change, but that's the plan for now. Rachel Westrick asks, she said, I heard only unvaccinated can transmit because they carry such a high viral load. Is that true or just a rumor?
That's a good answer. Yeah, no, that's unfortunately not true. And in fact, what we've discovered disappointingly is that vaccinated, that was mainly true before Delta. We know that vaccinated people carry just as high a viral load as unvaccinated people. So they are just as contagious, which makes them even trickier since they oftentimes have less symptoms. And like Jen talked about earlier, they may be the ones who just have, I just have a little allergy, a little runny nose, and not realizing that they could have COVID. And then again, if they're not wearing masks and going in places, they can easily spread it. So vaccinated people can spread Delta just as easily as unvaccinated people.
And the viral load is 1,000 times more than the original COVID. So it is such a high viral load that people are carrying, and that is leading to that easy transmission. So it's a very tricky situation because people who are vaccinated kind of feel they have a shield on. And we've been walking around all summer feeling like, all right, those who are vaccinated feel like, all right, I can go places and not have to worry, and I can take my mask off because I'm vaccinated. But the reality now is, you can be an asymptomatic carrier and have that 1,000 times viral load. You can have a little runny nose and again, transmit that to other people, the children, immunocompromised family, people who can't get the vaccine for one reason or another. So we have to consider that too. I wanted to go talk about events. We touched on it to some degree. And the Department of Public Health today said that they are planning on still doing the shoe. These large events are, as of right now, are still a go. There was a question about the wedding. We're learning very quickly because previously these crowds, if a vaccinated group, was more of a low-risk situation if it was outside. But if you've seen on the news, there's been these reports now coming out. Why we're learning about the outside situation is Cape Cod, which was a largely outside event, became a super spreader when there were crowds that were mingling in Provincetown, Massachusetts. We had the Milwaukee Bucks. They had their big celebration a couple of weeks ago.
Go Bucks.
Yeah, there's go. and those Wisconsin folk are very proud. And if you've seen images from the celebrations, it brought the mass of humanity downtown to celebrate. We have 500 plus cases of COVID coming out of that event right now. That's being tracked. So we're seeing these outdoor events become super spreader events. They're bringing together vaccinated and unvaccinated. Regarding the wedding, a month ago, an outdoor wedding would be a fairly low risk event, particularly for vaccinated folk. Things that you can do to kind of help reduce the risk, request that people who are attending the wedding, make an earnest request that they be vaccinated. I mean, that's the best thing that they can do for themselves before they attend such an event. Wear the mask when they're at the wedding. If they need to take it off briefly to eat, when they're done eating, put it back on. Try to stay with their pod, their family group. I know these are difficult asks, but nobody wants to be the wedding that their family members go to, and then there's a big COVID spread at their wedding, and they have their grandma sick from the event. And the tricky part is now too, is that it can be the vaccinated grandma who is getting sick. So, but previously, and as someone who's throwing a wedding, it may be part of your job to just educate your family, because a lot of people don't realize that if they feel that they are vaccinated, they're safe to go to these events. So really trying to get the guests, whether vaccinated or not, to wear their masks, but the lowest risk would be vaccinated and masked and outside.
And I'm going to add a third thing, just to for that person about the wedding. Again, there was a Columbus wedding 3 weeks ago, outdoors at one of the farms. And again, 150 people were at the wedding, and 30 ended up with COVID, including the father of the groom, who ended up in very serious condition, hospitalized, and they were vaccinated. Jen said it perfectly. I mean, although this implied that everyone's going to be vaccinated, so that's good. But I would suggest that they wear masks when they can, especially if they're going to be mingling. You want to wear masks. And the third thing you can do, and we've been trying this in various other events, and that is have them get a rapid test before they go to the wedding. Have them within, now nothing's perfect, but they're easy and cheap to get a $10 rapid test that we can do. And, it would not, you want to come to the wedding, we'd really like you to do a rapid antigen test and make sure that you're negative before you come, so you don't inadvertently have the disease and spread it to people. So you're trying to, again, it's just one more safety thing you can do. That's anything we can do to make it safe. Obviously, the safest is have the wedding, have no one eat, and wear masks. That's not a very festive wedding, and I get that. And so but we're back to spreading this at big events.
Yeah, and the rapid tests you can pick up at the pharmacy. The Walmart has them, CVS. And they come in packs of 2. And what is recommended is you can have the guests test 3 to 4 days before, and then test day of. If you have 2 negatives, that is fairly reassuring. The 3 to 4 days before, you can miss somebody that is negative 4 days before, and then turns positive right before your event. So if you test twice, that will lessen the risk. And that can be applied to other things and other events that people are having. Trying to.
But also, I'm just thinking, as a father of 2 daughters, who I got to marry off, that you can get 100 people, so that's going to be 200 tests at $10 a test. That's just another $2,000. That's for what you're paying for the wedding. It's just we did everything in units of 5,000, but it's less than a unit that you have to pay extra. You can send them out to the people.
Yeah, they can be party favors.
Exactly. Party pre-favors.
Yeah.
Okay, there's another question too about flying. A lot of people are wondering about travel. So, that's kind of a hot topic. Airplanes are going to be a little riskier places because the air, you're sitting next to somebody for an extended period of time potentially. The way that the air is filtered in airplanes is trying to minimize that, and masks are required, keeping in mind that there are going to be little children that maybe can't tolerate wearing the mask the entire time. So there will be those individuals who aren't masked, or maybe it's a member of your family that can't wear a mask because you've got the one with the little kid that can't do it. Things to think about, again, before going on any travel. If you're not vaccinated, get vaccinated before you take your trip. The masks will be there for everybody, but not everybody's going to be wearing a good quality mask. So make sure that you are wearing a good quality mask. The gator masks, they are shown to be ineffective. I sat next to someone on an airplane wearing a gator mask flying to Milwaukee. I was not happy. But make sure that I was double masked. So but make sure that you are wearing a N95 or KN95 or double masked or protected, because you just don't know about the person that's going to be sitting next to you. Know about the risk where you're going, about what areas have high transmission, and that's available on the CDC website. You can look up by zip code where you're going, so you have an idea about the risk when you arrive. And actually, the big problem with travel is not in the airplane, but it's actually in the airport. Because in the airplane, everyone is being policed to keep their masks on. And in the airport, everyone's wearing it below their noses. They're not wearing it at all. There's nobody policing what's going on there. And then here we are in a big indoor space with a crowd, which statistically is probably 50% not vaccinated just by, the United States vaccination rate. So being especially vigilant at the airport before you even get on the plane and when you get off the plane, being careful about eating in the airport. You just, and lots of good hand washing, and trying to socially distance when you're in the airport too.
And if you go to the bathroom, make sure you wear your mask and hand sanitizer before and after.
So I've got a question too that I think we've touched on. The question being, I've been vaccinated. Will Delta make me sick? And I think we've touched on that. That no vaccine is perfect. That we're seeing, 80 to 85% coverage against the Delta with our mRNA vaccines. So we're going to get some what we call breakthrough cases. They are relatively uncommon to get the breakthrough cases. They are a very small percent. You're still largely protected if you have the vaccine. The cases that we are getting as breakthrough are generally mild, like a cold. There are some individuals who are getting some more significant disease, but keep in mind that 99% of what we're seeing in the hospital are the unvaccinated. So is it possible to get sick and get COVID after being vaccinated? Sure, because the vaccine's not perfect. But again, the vaccine is doing what it was meant to do, which is prevent serious disease, prevent hospitalizations and death. And that it is doing an excellent job on. And again, it's going to be all about preventing the large viral load as much as you can, not putting yourself in a risky situation, reducing your risk, wearing the mask in crowded, if there's going to be a crowded location, wearing your mask indoors to protect yourself. Because there are things that you can do in addition to that vaccine to help you not have a breakthrough case. But again, the vaccine is very effective. There's a small presence of the breakthrough, but the majority of people actually are asymptomatic or don't get it at all.
And I'm not going to disagree with you. I think what you said was very accurate. We are, though, seeing a bunch more people vaccinated getting sick and in the community. And when we talk about, there's two types of sick, right? There's you get in the hospital, you almost die sick, and it's doing a great job of preventing that in the vast majority of people. But a lot of my patients who have gotten COVID, who've been vaccinated, have been pretty unhappy with how bad they feel. So it does give you a darn bad flu. And if you're a kid, you may end up with a fever for 102, 103 for 3, 4, 5 days, and an adolescent and adult. And so again, you want to do everything you can to prevent this. And the two best things you can do is get vaccinated. And we're probably we're preaching to a choir here, but also wear those masks. Wear those masks in indoor settings again, wear those masks in outdoor settings with lots of people. You'd much prefer to avoid this than hope that when you get it, it's mild. Again, I've got very little, fear of dying from COVID if I've been vaccinated, but I don't want to get it. I really don't. The people I know have had it have felt rotten, and both Jen and I have lots of patients who have been these long haulers who have been sick for months and months and months with lots of weird diseases and problems. Now, the good news is we've so far had very few of those in vaccinated people. Now, it's a little too early to tell, but it looks like we're having very little long hauler disease in vaccinated people. So that's some encouragement too. I've got the next question, and it's a very good one, important, timely, and topical, and I'm going to try to go through some of the science of it. What about booster doses? Could they help? Well, the first answer is yes, they might help. There's no question about that. Pfizer came out recommending a booster dose. Now, that's a little bit like your car dealer calling you and saying, you need a new car, please come in and buy one. I mean, they make the vaccine. It's not really, frankly, up to them to tell the country you need an extra dose. Not that they make their money on selling the vaccine, and you and I don't pay for it, but our government does. So they do make good money on it. Having said that, they've got some data that over time that the antibody levels go down. Now, those antibody levels are still pretty darn good and pretty protective, especially in people with normal immune systems. And they've also shown that if you give a booster dose 4 or 6 months after the original dose, those antibody levels go up very high, and they may be more protective against Delta variant doing that. So there's some very reasonable reasons to think about it. And many of us who have been in the field have thought we probably would need a booster dose at some point, whether it's this year or next year. So it's a reasonable thought. But what we need to do first before we make that decision is look at some information and data and science about what happens. And A, do we need it? When's the best time to give it? And C, the thing that everyone's been fearful of who doesn't get vaccines. Well, what about the side effects? What about the side effects? Well, even I would like to know, are there any consequences to a third dose of an mRNA vaccine? The nice thing is that Israel and Germany and Italy are doing this, and we should get some of their data pretty quickly, and we'll still keep following our data. So it's not going to. I think all of us believe that the FDA and CDC are going to make recommendations for booster doses in elderly people. Amazingly, that counts me over 65, and in people who have immune problems. And I think those are very real. I know some people who have decided to get their own booster doses. They just go to another pharmacy, don't tell them they've been vaccinated, and get a dose. I would strongly discourage that at this moment. I think we need to get a little more data, a little more science to know whether it's going to be needed, know whether it's going to be totally safe. But it isn't going to surprise me if we end up getting booster doses. And some of those things, some of that information may come very quickly. I mean, it may be within a month. It may be in 2 months. Again, Dr. Fauci, who you should always, in my opinion, listen to, has talked about him. And again, everybody just wants a little more data and science. That's what's driven the vaccine program. That's what's driven our treatment programs and stuff like that. What we really need, even more than a booster dose, we need a new drug. We need a new drug that all of us can take at the first sign of symptoms or at just exposure, like we have for the flu with medicines like Tamiflu, influenza. That's something we can. That's what we're missing right now. We've got great treatment if you're real sick. We've got a great vaccine. If you're critically sick, we got some stuff. But we really need it if you're kind of mild and we want to get better quickly.
Can I jump in real quickly?
Yeah.
Just a couple of questions. One, if you guys can talk a little bit about when you think the FDA will fully approve the vaccines instead of the emergency.
Real quickly.
Yeah.
In 2 to 4 weeks.
Okay. Anything for all three of them?
Anybody who's waiting for that, I'm going to tell you in all honesty, it's silly because it's an administrative thing. It's the science is all done. the side effects are done. There's nothing, it's just a very laborious process if you understand how drugs get approved and go from emergency use action to approval. It's administrative. This doesn't get, now, again, this may change some companies' opinions and hospital systems and our military, that they've been waiting. Once it's approved, they're gonna mandate that everyone who works for them gets vaccinated, and they can say that, oh, now we can say it because it's approved. But it really doesn't change anything. We've given worldwide, it's something like 4 billion doses. So if someone says, I'm waiting for more information, we've never given 4 billion doses of any drug. So I don't know what more, and let's talk about that for 1 second. Generally, do these vaccines cause side effects? Heck yes. There are a significant number of people who got them, who felt cruddy for a day or two, who got the flu for a day or two. We've got 1 in 20,000 of children who end up with mild myocarditis. We had 1 in 500,000 have allergic reactions. From the Johnson & Johnson, we know that 1 in about 500,000 got Guillain-Barré syndrome. So there are, 1 in 20, 1 in 50,000, side effects. And we've all heard about people who got them and felt, got arthritis for a week. And it's a nasty virus. So our immune response to it can be nasty sometimes. So there are but the question is, can it cause long-term problems? And the answer is, we've never had a vaccine cause long-term problems. We've been in the vaccine business for 200 years. We see short-term problems, and nothing a year from now, we're going to find out that you grow a third eye. That's not likely to happen with vaccines.
Yeah, in the history of vaccines, if there's going to be adverse reactions, we're seeing them in the first 2 months of when the vaccine comes out. So we're well past that. We were in those trials last fall. So we have a lot of data, and all of the vaccines that we have that we've been giving our children to go to school, there has been no sudden new adverse reaction that has shown up greater than 2 months out. So we truly have billions of doses that we can rely on to say, hey, everything is looking like it's these numbers that Roger, touted off, that those are your risks. If we ask you, what is your risk of being struck by lightning? It is 1 in 15,000. So what is your risk of an allergic reaction to the vaccine? 1 in 500,000. So certainly the risk of getting struck by lightning is not preventing anybody from walking outdoors. So we have to look at these relative risks. There's, and the risk from COVID, right, but prior to the Delta variant was 2% death. And that's the COVID virus. You just don't know how your body's going to react. You can't bet that you're going to have a mild case because nobody knows. So yeah, answer that question.
Can I throw one more question? Mm-hmm. So we've got one situational question, which we'll get to in a moment. Mindy is asking what about masking in school? I think I know your answer to this.
So yeah, we'll both answer it in affirmative easily. We as physicians, American Academy of Pediatrics, American Academy of Family Practice, all believe that all children going to school should be masked. That's a strong recommendation. So the people who care about children, the people who take care of children, the people who are expert at medical issues in children say that all children should be masked. Any other discussion about it is politics, not medicine. So every organization that is involved in that has said that. So I would be a strong. Now again, as I well know, as I hear school systems make decisions around the city, state, again, they're making different decisions, and they're not, in my opinion, they're not good medical decisions. They are political decisions being made, not and that's what's incredible, not in the best interest of children. And here's also what's going to happen. So what I think is going to happen in school systems that don't have masks, I think they're going to have a lot of kids get COVID. And I think those kids may get sick. They may not get too sick, but they're going to bring it home to mom and dad. And as I told you, this is as infectious as chickenpox. Mom and dad are going to get COVID. If they haven't been vaccinated, guaranteed, 100%. So all of you who don't want your kids masked because of reasons, and you haven't gotten a vaccine, good luck to you. I mean, you're going to get COVID. I'm pretty darn sure. And even those of us who have been vaccinated, there's going to be a lot more COVID among us once schools start, especially if they're not masked.
And the thing that we have to think about too is while COVID is gentler to children, the flu kills. We know the flu kills. That's why we give the flu shot, and we recommend the flu shot every year to children. COVID, if you look statistically at how it did last year, it was actually 4 times as deadly as the flu for kids. Kids in general do well. They have generally mild symptoms, thank goodness, but it can still be deadly for kids. And so they are a real risk. I mean, we are still seeing complications from COVID with kids, and they are fomites for the adults, but for them themselves, they don't have the ability to get vaccinated at this point, and we are putting them in real danger by not masking.
Now, why would you not want to protect your children? I can't. No one can. I can't figure that out. But why you don't want to protect your kids? And let me, since Jen mentioned, we believe that there will be approval of the vaccine for 5 to 12-year-olds, probably late October, November. That's best guess. I mean, that's the FDA is doing the studies are ongoing, and they're compiling data and looking to see that the vaccine works the same way it does in older kids and adults. And again, they'll always be looking at dosing. Do you need the same dose? Do you need 2 doses? May you use a lower dose? They're doing this at good warp speed. They're working as quickly as they can, trying to get it approved as efficiently as they can to get it to the younger kids. Again, as many of you may know, it's been approved in 12 to 17-year-olds, and still only a third of those kids have gotten it. So there's a big group of kids out there who are going to be starting school who haven't been vaccinated. And, hopefully as this Delta variant goes on and people see more information, parents will feel more comfortable about getting the vaccine for their kids.
We have another complication in Columbus too, that I just wanted to touch on. We have a public health advisory regarding RSV. So now RSV is normally a wintertime bug. And we are seeing, it's very unusual to see it at the levels that we're seeing it at in July, August. It's the cause of the common cold, but it can be very devastating for children. We have Children's Hospital normally expects a big swell of RSV and hospitalized kids in the winter months. And they are full right now with RSV. They are literally full here in end of July, beginning of August. And the challenge is that a lot of these symptoms that are related to RSV are identical to COVID in kids. Runny nose, cough, fever. It's going to be very difficult to distinguish what is RSV and what is COVID without testing. It's going to cause a lot of scare, a lot of concern. And, it's going to be, especially if we mask up in school, we're going to help prevent the spread of RSV as well, which is.
Let me, this is my last question. It was my last question, but we're in it now. So just a couple of facts. I mean, last week, there were 85,000 cases of COVID in children. And that's about 5 times what there were the week before. And it's increasing, it's doubling every week. So it's increasing tremendously. And many of those kids are sick. They're getting fevers, they're feeling bad, they're in bed for 3-4 days. Again, are they ending up in the hospital and ICU? Not too many of them, fortunately, although, again, a number have. Since the start of the pandemic, we've had over 4 million kids get COVID. And we've had somewhere around 700 deaths. So again, someone will say, oh, well, we always have deaths from other. Well, okay, you want to sacrifice 700 kids because we don't want to wear a mask. We don't want to protect them. Again, I think that's, I think our job, early in the coronavirus pandemic, what was so frustrating was patients would often say to me, when I told them we had 5 patients die in our practice from COVID, they'd say, well, how old were they? It's like, well, do you want to kill our old people? I mean, by the way, 3 of them were my age. So it shouldn't matter how old someone is if they're living, functioning well, being a good person and seeing other people, their mothers, fathers, grandmothers. And now we're telling the kids, yeah, go back to school. Don't worry about it. Masks are terrible for you because I'm not sure why, because as we all know, young kids can wear them effectively and efficiently most of the time, especially the girls. And it can protect them. So why would you not protect them? That's my discourse.
Can I throw out a specific question here? Aaron says, wedding coming up, unsure of how many guests and if they're requiring vaccination. She says, parenthetically, guessing not because they didn't ask me. The wedding is in Wisconsin. I'm vaccinated and recently had COVID. Thanks, 4th of July. I've been debating on going because I don't want to be the person that gets it twice. What are your thoughts? Any thoughts?
Did this person just have it?
Yeah, I think from the 4th of July.
That's what I said. Yeah. It's probably pretty safe if they had been vaccinated and they just had it. I mean, we haven't had many double Delta patients yet. She could be the first, but I would tell her to travel carefully, wear her mask at all times.
Yeah, the same rules would apply, just making sure we're wearing our mask. And I'm assuming that the vaccination was well before the infection, because then she kind of got another boost of her antibodies.
Yeah, it brings up a point that the people who had been what I refer to as the golden people before Delta were the people who definitely had COVID and were smart and got vaccinated. So they'd had kind of 3 doses of it. And we figured those people are never going to get it. But I've got a half dozen now who have gotten Delta, and they were triple effective. I mean, triple tested. So this Delta is just a nasty bugger. Now, all of them, those 3 at least, were very mild. So that's a good sign.
And having COVID by itself, I get asked all the time, well, I had COVID back in January, so I'm protected. Now the immunity wears off, and nor is it nearly as effective as the vaccine. So there's no number that we can look at to say, depending on how, what your response was. Did you get a 30% coverage? Did you get a 40%? And honestly, by the time you're 90 days out, do you have any coverage? Depending on how your body responded. So I've had now people with COVID multiple times, twice, because they were under the presumption that the first time that they had COVID, that they would be immune and that they didn't need the vaccine. Then they got sick again and were miserable. And now they're going to get vaccinated. But boy, wouldn't it have been the better case to get before they ended up getting it again and taking their chances. And these are, the individuals that I'm thinking about that I have treated that have had COVID twice are young people. They're in their 20s that thought, no way am I going to get this again. I beat it. It wasn't so bad. Well, the second time around, it was rough. So that's for our young people without any kind of health conditions.
Hey, Jen, why don't you take us a second? Let her answer the question when to call the doctor now. That's a
So okay, so as far as when to call the doctor, to review back to when we were in the start of the pandemic, I just want to review some of the basics of, all right, when you're getting sick, if you do get COVID, vaccinated or not vaccinated, if you're having symptoms of COVID, you should in some capacity get tested, whether it is through your doctor's office, whether it is through urgent care, or the minute clinics are doing it, doing a preliminary test at home. They're not quite as accurate, but they're fairly good. If you have symptoms of COVID, it is better to be safe than sorry and get tested in some form. So, if you are positive and you are having runny nose and a little cough and a low temperature, but not significantly short of breath. Okay, the worrisome symptoms would be being short of breath. Some people have run out and gotten little pulse oxes. That actually is very helpful. If your oxygen level is falling below 94, that is a time to call the doctor if you get to that point. If you're having moments of confusion or not clarity, that could be a sign of low oxygen. If you are having any kind of signs of a clot in your legs, swelling of your legs, that would be another time to give us a call. If your symptoms seem severe, we want to hear from you. We are also getting a lot of phone calls about I've been exposed. I live with someone who is now positive for COVID. I have been in a car with somebody who now tested positive for COVID. There's a lot of concern about what the quarantine and testing protocol is. And we touched a little bit on this. If you've had a significant exposure, and again, the 15-minute rule, 6-foot rule applied to the previous COVID, the Delta is much more contagious. So those little rules and time do not apply. It can be a very brief encounter that you have with somebody that you can pick it up. But testing on day 4 would be recommended. If you've been in direct contact watching for symptoms, if you get symptoms, again, call your doctor so that you can know. We want to know who's positive so we can direct your care. We can watch how you're doing with your symptoms. Certainly if things are severe, we say go to the ER if things are really severe, but most people we can manage at home. The vast majority we can manage at home with proper monitoring.
Thank you. Thanks for that info, guys. I think that I'm just looking to make sure. I think we covered all the questions. Some of them were covered indirectly, but you covered them. And a lot of folks are saying thank you for all this information. So make sure you pop on the Temple Facebook later on and look at those, because I think there's a lot of appreciation, because it's so confusing out there, and it feels like the news hasn't quite caught up with where you guys are and where the medicine seems to be. So we're very appreciative.
It's been. I'm going to make a semi-political comment, but not a bad one. But it has been a little disappointing. Having been a physician for 40 years, had incredible respect for the CDC. They were an amazing organization. And I think in the last couple of years, politics have been problematic from the organization from top down. And I think we had problems that got politicized. And I think even now with a different administration, they're still having trouble finding their best foot forward and giving us, I think they've been behind what's on the ground, what all of us as physicians have been seeing for reasons that are weird, because they get lots of information, have lots of smart people. And this has also happened at our Ohio Department of Health that I talked with them. And again, we said, well, why aren't you coming out with some of this? And sometimes they said, well, we can't make a mandate. And so it's been challenging for us as physicians, as challenging, again, trying to convince people to get the vaccine, a vaccine that can help save their lives and make them healthy. And we still are running into lots of roadblocks that are difficult. And so if we can make one last pledge and plea, for those of you who haven't gotten the vaccine for some reasons, talk to your doctor, talk to Jen Silver, talk to Roger Friedman, talk to a doctor you trust. And please consider it again. And also for your kids, if you're 12 and over, the American Academy of Pediatrics, almost every pediatrician in Columbus is strongly in favor of getting the vaccine. Virtually every family doctor in Columbus is strongly in favor. And so, talk to them and consider it.
We really appreciate this info, guys. So, a lot of this came up because we had our conversation last week about the high holidays, and we had one plan. Now we're shifting to another plan where everyone's going to be masked. What we're still trying to figure out about the outdoor services is, do people want to sit outside in hot weather with masks, or are we better to do drive-in so people can be in their cars? That I think they're equally. I mean, you'll say if they're equally safe, but I think that we'll try to make either situation safe, trying to figure out which one's the most comfortable. So if you have an opinion out there in Facebook land, let us know, because that'll be helpful. Any closing words from either of the doctors here?
Mask.
Fair enough. All right. We appreciate.
They're seeing it on the ground. So CDC is so behind, as Dr. Freeman said, because they're afraid of accepting the public. But the reality is, the vaccines are working, but they're working as they're supposed to work to prevent severe disease, hospitalization, death. We want to stop this process before, we don't want you guys to be the breakthrough cases. We don't want the children to get infected. We don't want our elderly and those people who can't get the vaccination to get infected. So please take this really seriously. This is all shifting. It's like walking on quicksand to give this news, because tomorrow there's going to be something else that comes out on the news. But Franklin County is surging right now. And this is before school starts, before these kids start mingling next week. So it's never too late to get the vaccine. It's always a good time to wear a mask and just make smart decisions, because it depends also on behavior. And we all have gotten more lax, during the summer when the recommendation was, hey, you're vaccinated, you can go out and about. And a lot of people have abandoned the hand washing and the distancing and the avoiding large crowds. So it's going to be difficult to dial it back, but it is so important to dial it back.
Thank you, Dr. Jen Friedman. I just crossed you guys. Dr. Jen Silver, Dr. Roger Friedman. There is a Dr. Jen Friedman out there, but she's from Milwaukee. So that's, we're really, really appreciative of both of you and taking this hour plus. And if folks have more questions, you can certainly email the Temple and we'll pass them on to these guys, and we'll go from there. All right. Thank you guys very much. And everyone watching, thank you. Stay safe out there, and we'll talk soon.